Thank you, Chair Harrington. Good afternoon, Chair Harrington, board, and all of our mayors from around the county. We really appreciate your time today. We do have a really serious, rather alarming topic to bring to you today. And as Chair Harrington said, even since yesterday when we completed this presentation, there has been updates and changes and new data, new recommendations. And so we're going to do our best to cover that for you today. One of the things that I want to say is a thank you to Chair Harrington, because one of the important things to note is that Chair Harrington is on calls with the governor's office, where OHSU and the governor's office is sharing data that is about a week ahead of the data that public health is receiving. And so we have been talking to OHA about how difficult that is, because we feel like we're oftentimes behind and scrambling. But in Washington County, that's not the case, because Chair Harrington immediately shares the data with us so that we can get ahead of it. And we're able to share it with our regional partners in Multnomah and Clackamas County. So a huge thank you to Chair Harrington for being willing to share that data with us and with the rest of the board and the community, because it's really helpful to get that. The other thing is that, as I mentioned, a lot has changed even since we put this presentation together. So I want to introduce Marie, because this is her debut in Washington County, and I'm really proud of the talent that we're able to attract here. So Marie is a doctor of philosophy in public health with a focus on health behavior. She also holds a master's degree in public health and a bachelor's degree in health sciences with an emphasis on community health education. She has a master's certificate in health education from the National Commission of Health Education. She brings to us 25 years of community academic research and government supervision and experience in public health. And most recently, Marie was working for Washington County since October as a research and evaluation analyst that served in the position of the COVID-19 epidemiology data and quality assurance supervisor. So Marie has a lot of experience and expertise, and we are very fortunate to have her. Also, and Marie will be going through most of this presentation this afternoon, but we also have invited Dr. Christina Bauman, who is our health officer, and Dr. Kimberly Repp, who is our lead epidemiologist for public health, who's also been with us for, I think, 8 or 9 years now. So 10 years, wow, okay. So it is a very talented group that's going to be available to go through this presentation and answer your questions. And of course, I'll be here as well to assist as needed. So with that, I will turn it over to Marie.
Thank you. Good afternoon, commissioners. Good afternoon, mayors. My name is Marie, and I look forward to sharing some COVID-19 data updates with you today. If we could advance to the next slide. Great. So some of the topics we'll briefly cover are transmission, projections, wastewater, some data about our children, some strong recommendations, and resources. Next slide. So I wanted to start with our Centers for Disease Control and Prevention. They have been tracking our community transmission of COVID-19. As we see here on the far left column, there are 2 indicators. The top row is the case rate for the past 7 days, and the bottom row is our test positivity for the past 7 days. If the 2 indicators suggest a different level of transmission, as highlighted here in the green box, the CDC recommends that the higher level is selected. And so moving to the right, we'll see the 4 columns are blue is the lowest transmission level, and red is our highest transmission level. Next slide. So as mentioned by Marnie, the transmission levels have changed since this presentation was submitted. So at the time of this presentation, we are looking at the CDC metrics, which are also available on the Oregon Health Authority website and dashboard. So this was for the week of August 1st. Our case rate for Oregon was 177 per 100,000, which it would indicate a community transmission of high. So in the red zone, the test positivity was 9.5%, which would be substantial. Again, following CDC guidelines, we would be in the red, in high. As of last night, the CDC metrics were updated and the OHA dashboard was updated. So for the week of August 8th, Oregon is now at 309 per 100,000. So we are still in high, we are just higher. Also to note, at the time of the older data, we were at average hospitalizations of around 25 per day. As we know, it's higher than that now. Next slide. When looking at Washington County, for the week of August 8th, our case rate was 86 per 100,000, which indicated substantial. As the data were updated last night for the week of August 8th, we are now at 129 per 100,000. So we have moved into red. We are at substantial now here in Washington County for our case rate. Our test positivity rate is still around moderate. Last week it was 6.4. This week it is 7%. Next slide, please. So about once a month, we are able to obtain projections from the Oregon Health Authority. The latest report we received was dated July 29th. And so these projections are for the time period of August 4th through 17th, which will be today. And so at the time of this report, OHA was expecting an exponential increase in our diagnosed cases, both in case rate and hospitalizations, which we have been monitoring, I'm sure, and we are seeing now. Next slide, please. At the time, they were also modeling our transmission rates. And so here, the black line shows the observed case rates, and the red line showed the diagnosed projected. And so we are seeing increase in community transmission projected, as well as we have been experiencing those. Next slide. This is the last slide from that report. This is also looking at hospitalizations, where the black dots show the observed daily counts and the red line shows the hospitalization projections, assuming the transmission rate stayed the same as it did the week ending July 14th. And as we see here in the red, the dramatic increases were predicted, and we have observed those in the past few weeks.
So Marie, I'm going to just add here, this slide, these last couple of slides are some of the differences that we're seeing between what Chair Harrington has received from OHSU and what we received about a week ago from OHA. And a couple things. I think one, it's important to understand that the data that that Chair Harrington has shared, the slides from OHSU, that is statewide data. And Marie is going to go into some of that and some local, but focusing more on our local hospital system in Region 1. And it's important to understand the statewide hospitalization is in dire, as OHSU is describing it, collapse. But our region, in Region 1, our metro area hospitals aren't quite there, although they are stretched paper thin. And our strong recommendations at the end today and the discussion that you all will have is really to prevent us from getting to that dire state that we see in other parts of the hospital system within Oregon. So sorry to interrupt you, Marie, but I just wanted to kind of point out these differences we go through.
Thank you. I appreciate that. So, all right. So this slide here was made available to us by Clean Water Services. They've been collecting data since April of 2020. I apologize, these images are not as clear as we'd like them to be. They are the best we could obtain for you. So they have been collecting weekly sewage samples from 4 water treatment facilities. They've been tracking COVID-19 in our community wastewater. So the blue line here are the virus concentrations, and the black line are the case counts. And so Clean Water Services has shared with us their wastewater reports have been used as an indicator of cases during major surges. They have also reported to us that as of July 26th at the 4 facilities, they are showing the Delta variant is between 80 and 100% of the viral load. Oh, sorry, next slide. Thank you. So earlier this month, as I'm sure everyone is aware, the CDC recommended universal masking for K through 12 and around the, and we have the masking here in our schools in Oregon. And around the same time, a report of the American Academy of Pediatrics and Children's Hospital was released. So I just wanted to highlight some of those data. So on the left side of the slide, the report noted that over 4 million children have been infected throughout the course of the pandemic nationwide. So they have represented about 14% of all cases. And in their most recent 2-week data period, so that was the end of July, so July 29th through August 5th, they are seeing increases in case counts as well as proportion of cases. And so the right side of the screen are just the last 3 weeks of data that were made available. And these are the case counts by week. So we see visibly the increasing trend. Next slide. Thank you. And so looking at our local data, so we have the regional dashboard that we're able to look at Washington County case counts cumulatively. And it is important to note that children in the American Academy of Pediatrics report varied in age range across the states. However, 0 to 19 was part of the age ranges. And here we have our 0 to 19 population in Washington County, and cumulatively, they represent nearly 1/5 of our COVID cases. So as we are aware, the governor and the state has taken some actions to provide some indoor masking guidelines, as well as universal masking guidelines for our schools. And since we are out of substantial and in the high community transmission, it is important for us to revisit our recommendations. And these recommendations are across multiple strategies, and they are needed to help us slow the spread of COVID in our community. And so 2 of the strategies that we'll review here are limiting our exposures and reducing the spread. And so effective measures, as we have seen in the past to limit exposures, include carrying and wearing masks. So again, for our ability to follow our indoor mask policy, but also if you're out and about and you're in a situation where you would feel that you cannot stay distanced, you have the opportunity to put on a mask. So we need to try and increase our distance again, keep that distance of 6 feet. We also should be avoiding unmasked crowds and large gatherings. And other effective measures to reduce the spread include following our quarantine and isolation guidelines, monitoring symptoms for COVID-19, getting tested regardless of vaccination status, and notifying close contacts of exposures as well as our test results. Our public health system is really burdened, and we can help out our community by staying in contact with our close contacts and sharing information. Additional recommendations for recovery is to continue to isolate and minimize our contacts. These have been effective measures in the past. Seeking help for severe symptoms, although our health system is experiencing burden, it is still important to seek help for severe symptoms. And then acquire about resources available. Washington County has a telephone number that the community members can call to see what resources are available. We also still want to encourage vaccination. We know that it reduces risks of severe illness, hospitalization, and death. They're free and effective and available to persons 12 and older. And I think here we'd like to encourage the continued updates of information, continue to seek information about safety, eligibility, and availability. As mentioned earlier, information about COVID keeps changing, and OHA just updated their guidelines yesterday to allow a third dose of Pfizer or Moderna for immunocompromised persons in our community. And so this is just another example of why it is important to keep current on information about COVID-19 community transmission and vaccination in our community. We do keep our website updated, so feel free to share these resources throughout the community. We have vaccine availability, including mobile vaccines, pharmacies, and events. And lastly, we have our website updated with important information, updated fact sheets, videos, websites, emails if people want to send in questions, as well as phone numbers where they can call and ask questions. And that is the end of the presentation for today. Thank you.
So Marie, thank you for the update and the new data. I want to end by sharing that the board, as acting as Board of Health, does have the authority to consider more restrictive community-wide measures. So the public health recommendations today that we provided, these are our recommendations that we're asking citizens to voluntarily do. But we look forward to your conversation today. And if the board is interested in considering other measures, then public health is certainly here and available to help you think about how those could be implemented and how we could support the board's wishes. I just wanted to share that. And I think that we are happy now. I think we're happy to answer any questions that you have.
I'll start if you don't mind. Can you speak to the difference between the level of hospital utilization that you're aware of here in Washington County versus that is represented to me and other county commissioners?
Sure. I think Dr. Bauman is probably got the most up-to-date information. She was on a health systems call yesterday, I believe.
Yeah, thank you, Chair Harrington. So the situation is constantly changing. As we know, hospitals have different resources that they can tap into, different strategies that they can use to make more beds available and to shift the population or shift the hospital patients to different levels of care. So absolutely across the state, the situation is dire. We've certainly heard about the alarming situation down in Southern Oregon. In our region, our hospitals are stretched. They are doing everything that they can to make beds available at the level of care that patients are needing, and they're collaborating among each other They have been working with partners at different levels of care to offset some of the burden, whether that's to direct patients to seek care at urgent cares, to extend hours, to work with emergency departments and social services to try and find the best location for care. So they are actively managing the situation. Their bed situation is stretched. They have absolutely made clear that an ICU bed is not the same as an ICU bed, and meaning that some ICUs are better staffed for higher levels of specialty care, whether that's someone that needs pulmonary support with ECMO or with dialysis. And those are certainly resources that are in very limited supply, and everyday staffing situations change. So I hope that answers your question. The situation is serious, not as dire in other regions, and it changes every day. So we certainly are keeping close tabs on what is going on and how we can help across our public health and health systems.
Okay, so before I call on Mayor Gibson, Snyder, and then Beatty, Commissioner Pam Treese is with us, but she is attending by telephone and doesn't have the ability to be transferred up from the attendee list or flag. So Commissioner Treese, do you have any questions at this time?
Thank you, Chair. I do have a question, and it's in regard to the efficacy of different types of masks. I've been seeing information about the types of masks that are indicated to be more protective than others. Can you comment on that, please?
Oh, Christina, do you want to take that, or I can take it either way?
Yeah, no, I can take a first pass, and if there's something else you'd like to follow up with, please. So fortunately, compared to earlier in the pandemic, PPE supplies are improved. So the a spectrum of effectiveness of masks for personal protection, the respirators N95 masks, especially if they're fit tested, are the most effective and used in our healthcare systems. Next would be medical and surgical masks that offer some water resistance, also offer a lot of personal protection. When it comes to face coverings, some of the parameters are that they're well-fitting without gaps, that they have multiple layers. Cotton multi-layer masks are effective for personal protection. And so that's sort of the range of personal protection. When it comes to public protection, that's another important aspect of the masks, in that mask face coverings, in that they contain droplets. And so again, multiple layers add protection from the spread of droplets from a person to another individual, and first contain the spread of the virus.